Hello, welcome to Power Pantaloons podcast. My name is Tonya. I'm your holistic cancer wellness guide. And today on the podcast, we have Glenna James. Welcome.
Welcome. Thank you for having me.
Will you please tell the audience what your zone of genius is?
I have two. Lately, and the last couple years, it's about women's health, so fertility and pregnancy, and helping women get pregnant, or even if they don't want to get pregnant, have a safe alternative to birth control. So that's one, and my other is I'm a holistic health practitioner, so I look at many different aspects of health. So holistic health practitioner and fertility and pregnancy coach. That's what my zone of genius is.
Fantastic. We're going to focus more on the second. Um, although, I mean, the first is super important as well. So let's talk about specifically what kind of wellness modalities that you focus on.
Oh, I'm a clinical herbalist, so herbs is one. I also do energy medicine as a Reiki teacher and master, so that's another aspect I tap into since I'm a certified holistic health coach. So I coach people. It's not a consultant. I am a coach. You do the work. I'm just there to guide you. Um, and also I have some certifications in fertility awareness and also a couple from my own journey, pregnancy related things that's happened. So I'm kind of all over the place, but I say I always stick to the many different facets of holistic health.
Right, holistic, absolutely. How long did you say you studied herbs?
Um, I went to a school and it was for about a year. It's fast paced, depends on what you want to do. You can take as long as you want to do it. And it was one of the schools that was under the list of the Herbal Association that all the herbalists go and you can get certified to be an herbalist. It was one of the schools that they certify. So, Heart of Herbs Herbal School is the one I went to.
Okay.
Shout out to Diana.
I I studied under Rosemary Gladstar's course, and I'm also a Reiki master, so I completely I energetic healing has been a passion of mine forever, and I think that that's one of the things that helped me in my cancer journey. You know, we started with mindset, but Reiki was super important.
Yeah, I don't push that on my clients because there's people that have different belief systems. It's there if somebody wants to use it, and that's fine with me. So I don't, it's in my bio. It's part of what I do. I look at things energetically, especially since I practiced yoga. So I look at it that way, but I don't push that on my clients. So I tend to stay away from the energy healing as much as I can, unless somebody has come to me and asked because of different people's
Belief system.
sensitivities.
Yeah, absolutely. One of the things that I do specialize in, though, is helping individuals intuitively choose what alternative wellness modalities they want to use when they're walking whatever journey they're in. I specialize, obviously, in helping cancer survivors. So, and it's super important that the individual that's going to be doing it is comfortable with it and wants to do it. So I respect that. Um, I was one of the girls that picked all of the things because all of it sounded wonderful, right? But I understand that not everybody is comfortable with it. But like, if you look at all of the different religious practices, they all have some form of laying on of hands. So it really depends on how you want to present the material because it's the
Yep.
same thing.
Oh
Or
yeah.
my
Oh
opinion, it
yeah.
is.
I agree.
So tell me more about how you would help somebody. Let's say somebody was walking a cancer path. What kind of herbs or protocols do you think that you would recommend, generally speaking? I know we're not giving medical advice or anything like that, but where would you start?
First, after the whole 15 minutes consultation and discovery call, and then looking at that consultation would really be looking at all of what they had before cancer, any other illnesses outside of cancer. So I would really do a deep dive. When it comes to herbs, I would really focus on the immune system because of immunotherapy and how that is helpful for cancer. And because it's kind of like I've talked with many people in my own family about cancer can be looked at as a metabolic disease people because it can go throughout the whole body, and it can be an autoimmune issue because of how we have these killer T cells that go in and supposed to kill cancer, supposed to kill what these cancer cells that are small, but it doesn't happen. So something's going on with the immune system as well. You know, so I would look at the immune system, see if they're what treatments they're on. So if they're on chemo, it would all be supportive. It would all be to support their gut. It would all be just to help them relax. If they were taking radiation, it would be doing that. So it would be all based on the patient. It's
Yeah.
all personalized. I try to personalize it. I don't try to say this is my protocol. I have protocols and I have herbs I would use. So if it was for comfort, it would be they're having problems sleeping, it would be valerian. If they're having problems stress, it would be chamomile. I always start with like Rosemary Gladstars always says you start with the most gentlest herbs, then work your way up to a more tonic, powerful herb.
Yes, yes. Valerian. Smells like stinky socks.
Yeah,
It
and then
works so
I would
good.
look at food. I would look at food. I would look at what are you eating. So if you have an upset stomach with cancer, you would want to have light meals, but something that would be fueling. So, ginger as an herb, ginger, put that in. If you can't do anything, can't hold anything down that's solid, let's liquefy it. Let's liquefy it. But I would also be working on making sure you have strength and your support system around you. And mindset would be important. Are you going in it as it this is your death sentence? Are you going into it to fight it?
For me, I believe that mindset is the number one thing because it drives the bus. Every day while I was going through my cancer journey, I changed my underwear and I put on a pair of Wonder Woman's panties because Wonder Woman doesn't die. And I really do attribute that to like 95% of the reason I'm still here because you may or may not know this, but a healthy uterus is only 4 ounces. And when they took mine out, it was over 10 pounds. So that's significant. And not that they ever said it, but I don't think they expected me to survive the very aggressive cancer that I had. The chemotherapy and radiation protocol was, I mean, I was doing it for almost a year. It was long and drawn out, and I had to go inpatient for my chemotherapy 4 days a month. We did 3 of those, and then we stopped for a month, and then I had 5.5 weeks of radiation, and then I had a little break, and then we did 3 more of the inpatient. The chemotherapy that they gave me was so toxic, they had to give me rescue drugs before, during, and after the chemotherapy. And I was like, rescue drugs? Like, you know, it was a lot. And my conversation with my oncologist about herbs was he's like, no, no herbs. We're not doing herbs because it'll counteract the chemo. And I was like, well, what about aromatherapy and flower? As he's like, I don't care what you walk on, smell, or whatever. Like he literally rolled his eyes at me, and I was like, okay, fine. If you're letting me do everything else and you just don't want me to take the herbs, I can live with that. Um, and that's the protocol that we ended up doing, and I did, grounding and crystals and sound healing and all these other lovely things. And once in a while I'd have a cup of herbal tea, but I trusted my oncologist, which I think is super important. You really need to trust your providers, and you all need to be in alignment. But it walks back to mindset, because mindset, it does, it drives the bus. If you're going in it with a I'm going to kick cancer's ass philosophy, and you're really putting that energy forward, you can tell when somebody's decided to die. You can see it in their eyes, you can see it in their actions, and they have the right to make that decision. Everybody, you don't know what their fight was. You have no idea. You have no idea. And so you have to respect everybody's own decision on that, whether you like it or not. Most of the time we don't like that, but mindset really does. It impacts everything.
And since that was a female form of cancer, I would also be looking at your hormones. So if a female came to me and they had cancer and it was like breast cancer, it was in the uterus and they had to get it out, it's no different than you getting a hysterectomy. So I would also look at your hormones. So that's also where I think my practice as not just a holistic health practitioner, but also with the female anatomy, I can marry the two.
Yeah.
And that's beautiful. And their story is beautiful too. And having you not give in. I have my own history in my family of cancer, and I have ones that they were old enough they're like I can peacefully, and then ones that were like, no, I'm not giving in. And I thank immunotherapy every day for that specific person.
I Yes, I have lost loved ones to cancer, and while many of them were older, not all of them were. My best friend from high school helped me through my cancer journey, and like 5 or 6 years after my journey was done, she ended up with ovarian cancer, and she decided she was done. And I had to learn to respect that, even though I hated it. And she's been gone a couple of years now. Uh, it's super hard because, she just never, she just didn't want to continue to live. And that's really what it boiled down to. And it's hard. It's super hard. Oh, yeah. That's one of the most difficult things about loved ones, is when they make decisions that they think are right for them that you disagree with, learning to respect them enough to respect their decision, whether it breaks your heart or not.
My grandma was one of those. She was 60 years old in her 60s, and she fought it, and having to see her suffer, and I knew. I had this feeling like the last time I saw her, I was like, I already knew because I was pregnant with my daughter, and I just had this overwhelming feeling. I knew she was not going to be around for my daughter, and I accepted that.
Yeah.
And it took me until just the last couple years of my life to realize that I'm happy she hasn't been around to see everything that's happened with the world, everything that's happened, because I don't think it would have been a perfect place for her. And I think she's with me every day in that weird way.
Not weird. It's not weird. I I do think that ancestors and those that visit us and support us. The day I went in for round two of chemo, my 18-year-old cat decided that was the day she was leaving this plane. And so on my way to the hospital, I had to go to the vet and put down my baby. However, there was this little divot in the pillow next to me, this warm, purring divot in the pillow. And for each of my chemo visits in the hospital, there was that space on my pillow that nobody could explain, right? Is and After I finished my last round of chemo, there were no more divots in my pillow. And I thought I was going to be absolutely devastated by her loss after living with her for 18 years, right? But I have a piece to it. And I know that she's now chasing squirrels in the sky or whatever she's doing, helping whoever she's helping now. She helped me when I needed it most. And now, so I agree. Like I absolutely feel that that's correct. So your grandma is around and giving you forehead kisses and all that lovely stuff.
Yeah, I believe that it was seeing her journey with her illnesses, having my own journey, having family members that have their own journey, even my own husband and my own pet and other people, even my kids, inspire me to continue to help other people. It's not, oh, I want to be this because it makes money. It's, yeah, I get money from it, but it's also I get to help people. And it's that outcome, seeing somebody get healthy is just like, to me, is, well, I'm trying to figure out the word without getting upset. It's it's a miracle to me. It's a miracle because it's like you took my advice, yes, as your coach, but look, you did the action and look what happened out of it. And that's like, wow.
Yes, I helped you transition this pain point. I helped you. I part of the reason that I'm doing what I'm doing now is specifically because when I was walking through my cancer journey, I didn't have a resource like me. And I want to be that resource I needed for other people, what that I didn't have. It wasn't until like 10 years after my cancer journey, I found out that there were nonprofit organizations where people volunteered to drive you to your appointments. I drove myself to my radiation appointments. I should not have been on the road. Worse than a drunk driver, honestly. Looking back on it, in the moment, I didn't see that. But looking back now, there's absolutely no reason for me to have been on the road. And I didn't have anybody to do it. My sister was working 16-hour days to keep a roof over our head because my income was gone. And it took short-term disability 4 months to send me a check. 4 months. Like what were they expecting me to how were they expecting me to eat or like it's ridiculous that's a tree branch we could talk about that forever, but it's amazing what resources are out there that we don't know about because they're hidden gems. And if I can help even one person mitigate some of the pain points of their cancer journey, then it's worth me talking about it. You know, if you have a radiation on your abdomen, chances are you're going to have poopsidents. And you might want to be prepared for that. You might want to have the to go get to go kit with your baby butt wipes and your wee wee pads and all of that. Change clothes, like because you never know what's going to happen. And that's because my body doesn't give me the signal like it used to. So once in a while, we poop our pants and we clean up and we move on. For a long time, I was super humiliated by it, but back to mindset, you know, you can't control the situation. You can only control how you react to it. And some people are never going to age to a point where they're going to start pooping themselves again, but everybody's done it. Everybody. Like we started in diapers, and if we're lucky, we end in them. So just having conversations about the awkward stuff and, you know, the sexual dysfunction, poop. We talk about poop a lot over here. We talk about the fact that you might lose your teeth and have to wear a partial. And these aren't real, but I'm still here and I'm grateful for the vessel that I have. It has been absolutely beautiful for me. Um, Now in my 50s, it's so weird to say out loud. It really is because, I feel like I just turned 22 yesterday, right? Kind of ridiculous. But being able to help people just by sharing my stories is very fulfilling to me. It's not about the money. It is absolutely about helping people through some of the more difficult challenges of their time.
And that's wonderful.
Yeah, absolutely. So we talked about energy healing for a second. We talked about herbs. I love herbs. I If you could see my table. Nutrition is super important. That was one of the things that I didn't work on during my cancer journey, but I am working on now. And the more research that I do personally, the more important the nutrition is in not only fighting things like cancer, but preventing things like cancer. Uh, it's kind of insane when you look at what sugar does to your body. Cancer just eats that up. And what they sell us in the supermarket is very good to walk around the outside and just hit the fruits and vegetables and the frozen stuff and leave all of the box stuff alone. But unfortunately, that stuff is cheaper. So like that's a complex conversation to have too. And I don't know if we're ready for it as a society, but we need to be.
Yeah, we do. When you touch on nutrition there, and the thing about that is, I had that conversation last night with my husband. It's kind of funny how you have these conversations, they end up in your daily life. It's convenience. We're conditioned to the convenience of being able to have it in a box. And it's like I say to people I know, my clients, there's nothing wrong with that box of macaroni and cheese. It's what is in it. It's that food label. It's okay, it has all these dyes, it has wheat in it. Okay, you can have a little bit of wheat. I'm not saying you have to go gluten free here, but is that whole grain wheat or is it white flour? It's like, let's make the little steps because not everybody has that time, especially if they work a 9 to 5, to sit there and make fresh pasta. We don't live in that time, but if you can, do it. And if you do work, it's also batch cooking your stuff. So it's running into those people that don't want to cook, that say, no, I want the fast food. It's like you don't have time, so you're giving your kids and you those fast foods or that easy microwave dinner. It's like batch cook your stuff on the weekend. Instapot. I have an Instapot. I'm not ashamed of that. Sometimes I don't want to cook. I put it in the Instapot and like you do your thing. you know, it's doing that and starting with little steps. Instead of having 5 sodas a day, why won't you have one soda and some water? Or buy yourself a soda stream and just use it to get the fizz. It's finding those places to navigate and then slowly build up. So I think I heard it from a nutritionist or maybe Mark Hammond or somebody. You can have some bad stuff like 5, 10%, and the rest of it all be good. Because you don't want to deny yourself. That's what happens. People feel like they're denying. So you got to give yourself that little percentage, but balance it out with good things.
I, you know, I, it's interesting that you bring this up because I think that one being 1% better is every day. Like so you do one thing and you start with little changes to your habits. And as you integrate those things, then you pick the new thing that you want to do. Uh, so, for example, last year, 2 years ago, I'm not sure, I started drinking kombucha on the regular, and it would be one part kombucha, one part cranberry juice, and then one part ginger ale. And I did that for quite some time. And recently, like within the last month or so, 2 months, I'm not sure, we decided that the ginger ale was going to go away, and now it's one part kombucha, one part cranberry juice, and one part herbal tea. And this week it is rose and hibiscus. Last week it was rosemary. The week before that it was mullein. Like, just pick the herb and I just put it in a coffee pot filter and just brew like a pot of coffee, and now it's a pot of tea, and I just refrigerate it, and that's the, and it's a simple change, and I'm doing it in steps. The next thing that we're tackling is the coffee. This is not coffee. This is mud water, and we're working towards making our own mud water with adaptogens like ashwagandha and then all the mushrooms, because mushrooms are anti-cancerous, and because of my own personal history, I want to fortify myself with that kind of stuff. And it's in a chai base. And so there's the turmeric and the ginger and the cinnamon and the cloves and all that beautiful stuff in there too. Little steps at a time. Giving up the coffee is going to be a big thing. So we might have 1 cup of coffee a day and then a couple cups of this a day. But I have expressed it to my husband, and he's all right. He's on board, so we're gonna start doing that. I'm like, we can wait until we come back from vacation to do that if you want, but just doing it on vacation, that'd be kind of crazy. But it's steps like this that are easy and manageable, and as you do them, you get healthier, and you're willing to try new things. And then over the course of a year, you can look back to see what you've transitioned and where you're at. And it's just by being 1% better every day. Because if you go all the way in, and it's not sustainable for most people. Most people can't do radical change like that. You need to have little baby steps.
And you talk about the coffee there. I have got my husband, he used to drink a whole pot of coffee or more down to 8 cups, and you know what? Easy thing if somebody's used to drinking a whole pot of coffee, use a coffee press. It's less coffee, but you don't got to use as much of it. And it's in a press. And you'll be, look, by the time you're done with that press, you already know you got enough coffee. If you need to measure it, that's a little thing you can do. And you talk about hibiscus and all those herbs that you were just mentioning, they're very good for your heart and for your blood pressure, and they're very anti-inflammatory. And my husband had high blood pressure and he wasn't on medicine and he had tooth issues. For a doctor to come in at his getting his teeth out saying, you say you have high blood pressure, but I can't say on this, especially with extreme pain. What are you doing? He goes, hibiscus, and she wrote it down. And there's been studies at Yale and other universities that hibiscus is as good as high blood pressure medicine.
Yep.
And you can just make it in go out and get canning jars. Make it in the canning jars, like Rosemary Gladstar says, and put it in the thing.
You say that. And I'm sitting there. That's my hibiscus rose.
Yeah. And you can make it in there. You can just brew it and put it in there and put it in the refrigerator.
Yeah,
So you have it.
absolutely. Absolutely. I have a half gallon mason jar, and then I have the like little screw on pour lids on it, and the coffee pot is big enough to fill the half gallon perfectly. And that's what I do with the tea. And you're right, the hibiscus and rose are really good for heart health, and that's important to me because my grandfather died of a massive heart attack when he was 45. My husband has allergy issues, which is why the mullein happens. And you know just and it's beautiful, right? Like, it adds a nice little, and it's an easy way to take it where it's not like some people don't like tea, right? And they're like, well, then that sounds gross. And all right, so just sprinkle a little stevia in it, and it'll sweeten it up, and it'll be fine. I mean, I don't know that I'm gonna take vertebrate tea or valerian or artichoke because they're super bitter, but there are lots of tea blends that and you can make your own, uh, and it's fun.
Tinctures. If you don't
Tinctures,
like that, tinctures, that's another thing, because then it's diluted in the tincture.
yes, tinctures are a real easy way. And learning how to prepare your own herbal remedies is easy and inexpensive.
Yes, yes, it is.
And the more you do before you receive a diagnosis, the more you do the earlier in your life, the better equipped you are. Like you don't want to get to my age and start now. Like I have now finally committed to losing a bunch of weight, and it's a lot harder at my age to do that than it is, if I had done it in my 20s. It's doable, but it's not easy. Oh,
And when it comes to weight, the BMI is, I had a
garbage.
doctor tell me BMI is, don't do it, because everybody has to. I know people are going to make fun of me because of South Park and the reference of, I'm big bone type of thing. But it's true. Some people have, based on our DNA and based on where we've come from, different bone structures, different muscle structures. So somebody like me personally, you might look at me and because I got a goose neck and all this other stuff and say I'm obese, but I'm not. I'm overweight a little bit, but my weight, a lot of it's muscle, especially in my legs and stuff. It's in my muscle. And having a C-section like I did, you're never going to have a flat stomach again. You get over that.
The society's obsession with the belief that skinny equals healthy is blatantly untrue. You cannot judge health by looking at somebody's body type. It's horseshit. You know, I'd go into new doctor's office after new doctor's office, and they would assume that I have high blood pressure and was diabetic. And I'm like, where do you get that from? And they'd look at me by your weight. And I'm like, well, you haven't examined me. You haven't looked at my medical history. You've already decided that I just need to lose weight. I'm actually one of the healthiest fat people you're going to meet. I don't have any of that. The worst thing that's ever happened to me is my cancer bout, and that's done. And you're sitting over here judging my health based on the size of my butt, uh, and you went to school for that. Like it boggles my mind. But and people will look at skinny people and assume that that's healthy. You don't know what that skinny person is struggling with. You don't know that they're trying to put on weight or that they have, no stamina because they're not eating right or whatever, right? Like the chips and drinking and whatever she's doing, but she's healthy because she's skinny. It's ridiculous. It's absolutely ridiculous.
Yeah, and but there is where you go, you're too skinny and it's a plateau. Same with weight. There is a point where there is a plateau, you know, and it's just too much. And I think Brendan Fraser made a movie called The Well about a guy, and he had an eating problem, and he knew if he didn't start even losing a little bit of weight, he was going to die, and he just gave up to it. So
Yeah.
it's like there's that plateau of where you personally going to be healthy. And that's what I do with my clients. Okay, you don't want to, you're 199 pounds. You have high blood pressure. Let's lose a little bit of weight, or you want to lose a little bit of weight. Let's make it healthy. Let's look at your mindset. Why are you trying to do it? Are you trying to do it to fit in? Are you trying to do it to be healthy because you don't want to have those issues? So it's like, and that's if it's a mental health issue, I'm like, you need to go see someone. That's out of my practice and scope of practice. I'm not touching that.
Yeah. I, the mindset behind it is important. The the plateau is a real thing. Like some people, that's just the weight they're going to be, no matter what they do. Um, but you know, I think that sometimes that might not be true. Like if you start to eat right and you cut out the things you know you're not supposed to be eating, and you start, I call it recreation because exercise is a punishment and recreation is fun things. So if you recreate correctly and enthusiastically, you know, and things like that, which is what I've been doing for the last couple of years, and I've lost 65 pounds. So, and I'm not recreating enough. Like, and that was just small changes. The kombucha was one thing, I because giving up soda, huge, huge for my health. Um, Smaller portions, only having one serving, cutting out most of the white processed flour stuff and starches in that way. Like you can get your complex carbohydrates from your other vegetables, and it's made a tremendous difference. My stamina is 5x what it was even 2 years ago. So
Yeah, and it's also people think, oh, I have to exercise, I have to do 15, 20 minutes an hour. It's like, okay, you can do some yoga for 30 minutes, but it's like, are you sitting down after that most of the day? How many times are you up doing stuff?
yep.
Oh, I'm doing laundry. Okay, you're doing the laundry, you're up doing something. Instead of sitting down doing the laundry, why aren't you standing up in a movement, in some type of movement, folding your clothes? Because then that's put on some music and stand up and fold your clothes. That's still moving your body. The smallest things matter because then by the end of the day, you can say, wow, I'm tired. Wow, I spent these many hours up on my feet
Yep.
moving.
You dance laundry, make a new thing. Dance cooking, whatever it is, right? Like, yeah, uh, it does. Back to that 1%, just changing a little bit, make a new habit, and you will be surprised at what you can accomplish in a year's time just by doing that.
Some people I know that I've coached and I've had students who they took that small 1% and they were able to do it as 5% because they were able to be because they got empowered and they made that not radical change all at once but was able to accelerate it because they saw that. So it's the small goals, it's the big goals. I'm going to lose these many pounds, okay, but how are you going to get there? It's those small goals into that. And that's why I think working as a coach is so important because we facilitate and we are the support behind a client. We give them stuff to do, yes, but we're not a consultant. We're not going to talk your ear off and tell you you have to do this. We're going to be like, okay, it don't seem like you want to do this. What are you willing to do? There is a point with clients you can go with against the grain. You know, there's some ones that are like, okay, you didn't do what I asked you to do for 2 weeks. Okay, then why do you need me? You're not. So it's that point of change you got to really look at when you're
Accountability.
a health coach. Yes, are you willing to be accountable? If you're not, then you're not ready for a coach yet. And I never cut off people. I'm always like, here's some resources until you're ready to make that change because I think cutting somebody off that's not ready for accountability yet, you take their choice away if they want to be accountable later.
Yes, it makes it harder for them to step up to the plate later. Absolutely. Yeah. And accountability is huge. And having having accountability partners or buddies to talk to about whatever, right? Like it's a huge thing. And when you're going through a health crisis or whatever it is, having somebody to hold you accountable to just getting out of bed every day. You know, I turned into a giant cat because I was sleeping 20 hours a day because of the chemo. But, you know, having having my sister around, and she's like, it's time to get up and eat, and she would hold me accountable to get out of the bed. So I get up, change my dirty underwear, put on Wonder Woman's panties, because that's what we did every day, and then go have dinner with her, and I help her clean up and then climb right back into bed. I did that for almost a year. Like, I didn't do much because I was exhausted because of the chemicals in my system.
Yeah, cancer, truthfully, I'm going to say this, and it might seem weird, but I don't care. I'm going to be vulnerable. I think the way we deal with cancer needs to completely shift. The way we treat it needs to be completely shifted because we know for certain cancers this work. We know immunotherapy works for certain breast cancers and other things. We need to make a paradigm shift because sometimes chemotherapy does not work. Sometimes radiation does not work. And earlier diagnostic tests, like for women, we know if it's cervical because we go get our uterus checked. We need to be able to feel comfortable with those practitioners to do that and not feel like they're shoving us out 15 minutes, you're done. We need diagnostic tests for certain cancers, and we also need better treatment.
We need the diagnostic testing that actually detects it early. And I say that as someone who had over 10 pounds of cancer removed from her body, and there were no blood markers. There was no cancer in my blood. My pap smear came back fine. The transvaginal ultrasound came back fine. They had to do a D&C to find my cancer.
See, I'm
I'm
sitting
not
here and
kidding.
I my face is like, and I'm going through like if you were a healthy person, had no endometriosis, have none of this, and it just happened all of a sudden like that, how did they get that big? And that's the thing in my head is like, I'm sitting here feeling that you were, and I'm not, I have nurses in my family, so, and I have, respiratory therapists in my family. To me, I feel like you were underserved, and I'm not even a doctor.
It, maybe, maybe, and I think it has to do with the fact that even so, last year I had another cancer scare, and I ended up going to see. I'm fine. I don't have cancer again. Um, I ended up seeing a hematologist oncologist, and she did some testing, and she's like, well, you don't have any markers in your blood, so you're fine. And I was like, that doesn't mean fuck all. And she was like, what? And I was like, when I had my cancer and they removed 10 pounds of cancer from my body, there were no markers in my blood. And the look on her face was like I hit her upside the head with a 4x4. She had, like, she didn't believe what I was saying. And her specialty was blood oncology. And she was like, she was mouthing, that's impossible. Well, incorrect, because it's clearly possible because I had multiple blood works and there were just no markers in my blood. And pap smear failed me because year after year they came back fine or inconclusive. All right. So then we do the ultrasounds and the transvaginal ultrasounds. All that came back fine or inconclusive. They did this weird test where they inflated my uterus with saline and then imaged it. That
And I
came
bet
back
you
in.
were getting sick. I bet you were getting sick the whole time this was happening, trying to figure it out what was going on with you.
Well, we found it in time because I'm still here 16 years later. But if I didn't advocate for myself, and like my oncologist, she's like, okay, so we've done this, and this. And she's like, the only thing else that we can do is a D&C. And I'm like, then schedule it. And so that's what we did. And that's invasive as heck. And you know, being in that, like, I knew there was something wrong. And my doctor trusted me enough to know what was going on with my body, to know that, to continue to try to find out what the problem is. But had I not been the squeaky wheel, I wouldn't be here. And so many people don't advocate for themselves. They don't. First of all, there's no training on how to have a doctor appointment. There's, like, you don't know what you can and cannot do. You have no, most people don't know you can fire your doctor. Most people
You can
don't
get a
know
second
that
opinion.
you can get a second opinion, but if the doctor is not actually doing what they're, you know, you can also call the insurance company and go, uh, the doctor didn't provide these services. And if they're an in-network provider, if enough people complain about it, they could lose their network status. And that means something to the doctors because it's a higher pay rate. But, and people don't know stuff like this. And absolutely, if you want something done because you live in your skin 24/7, you're in your body. So you know when something's wrong. There's that little tickle at the back of your head or whatever. You know something's wrong. So your health
Yep.
is your responsibility. Yes, your provider is supposed to be helping you, but they're so overwhelmed in this system right now that it's really hard for them to properly care for you. So you have to fight for your care, which is ridiculous, but it is still your responsibility. You are your responsibility.
Yeah, and that's why with the women's health aspect of my business and stuff, knowing your own menstrual cycle, like what happened, that was in the reproductive organs, knowing that, knowing about your cycle, tracking that, understanding it. We aren't taught this in sex ed.
We're not
There,
taught
I
nothing in
didn't. I'm not saying anything, but even in anatomy classes or biological, when I've learned things about even the male anatomy that I didn't even know about that or my own. I'm like, wow, wow, we are in this. Even medical science is like, if you don't have a cycle within this parameter, you're not normal. It's like, but that's not right. So it's like this old mentality. And they do that with everything. They do that with blood pressure. They do that with cancer. They do that with this. And it's funny how science comes out years later and says, oh, gut health is important because of this and this and this, because it helps with your brain. It's like, well, where was this? So that person that was saying this, let's say 10 years ago, was considered a quack, just
Yep.
understanding it. Now it's scientifically based. I like to stay in the scientific parameter, but I am okay with if I can actually prove it going on the other side of it. I stay in that medium. If it's already been scientific proven, cool. If it hasn't been, but there is peer reviewed evidence and peer reviewed to prove this, I'm okay with being called unorthodox in that way.
The peer review, you know, a lot of people don't understand what that is, you know, and how long something has to be peer reviewed before the medical society as a whole will consider it something acceptable. Um, I sometimes I think that that parameter is far too long, on diagnostic testing for markers and in gene testing and stuff like that. And medical insurance companies are still denying it as experimental, and it's 10 years later, like, and there's so much scientific evidence, and they just don't want to pay. That's really what it
Yeah,
boils down to.
yeah, and it's and on that you also got where sometimes you have different competing um sources. And that's where I think my master's degree came in handy when we had to do a meta-analysis and not look at it. It's kind of like on news media, being able to look at different aspects and make your own opinion, but then also look into where those medical reports are coming from. Where's your doctor saying, oh, this medicine works? I want to see the stuff because sometimes those side effects they don't tell you. Like with birth control, they don't tell you. It's like, where's the history of birth control? Where's the history of all these stuff? Look behind it, and you're going to see competing things. And if you can prove that there's more negative than positive for that, then you can make your own opinion. Don't just take something your doctor tells you to, unless you really need it, because some things are prescribed to people. Like, oh, I have a side effect from this drug. Let's give you another drug to compensate that.
I that's a whole rabbit hole. And
Yeah.
the the way that non-white men are treated in the medical system, because all of the studies, everything is based on white men. And if you're not a white man, you're subclassed because all of us are different. uh, uh, you know Health is something that is, it can be. So men have different symptoms for heart attack than women do. And for a very long time, women were having heart attacks that were not being seen in advance because the symptoms were so different than what they expected, because all they ever studied was men. And if you're a person of color, you're even more screwed. Like, so it just, and I that is now finally starting to change, but it's 100 years too late, right? Like, we should be studying all of that, because all of that is important. And the fact that birth control as it is still available for women, and there are, I mean, most people don't even know it, but there's male birth control out there. Most people just have no idea that that's even a thing, because the onus on birth control is on women, which is another tree branch that we could talk about for an hour and a
Yeah.
half
Yeah.
and still not, like,
Yeah. Yeah.
I have many soapboxes. They line up.
Same
Many
here. Same here.
soapboxes.
Same here.
um
But I think they all integrate towards a whole
yes.
holistic approach.
Yeah. Yeah. Absolutely. So, there are definitely herbal ways to regulate your hormones. And calendula is a beautiful thing. And just the whole system needs an overhaul. But that's
Yeah.
besides the point. That is the point. I don't know. But advocating for yourself is super important.
I agree with that. And I even try to help my clients do that. That's the whole thing. I have a motto, I say it every now and then, your health is in your own hands.
Because it is, Glenna. It absolutely is. So why don't you tell the audience how they can find you?
Okay, I have a website, it's theholisticglen.com. And also you can find me on Facebook or Instagram at the Holistic Glen by Glenna James. And I see many different clients. I'm not very high on the payment scale, and if you can't pay it all up front, I always allow you to have a payment plan. So any women, even men, can come to me for health coaching and holistic practitioners ish stuff. And also, if a woman needs anything with menstrual stuff, I have courses for that for pregnancy or not, just to regulate your cycle.
Super important. Thank you very much for being on the show today, Glenna. I had a great time having the conversation.
Thank you for having me, and I really enjoyed it.
Bye, everybody. Till next time.
Bye.